Answer all popular questions about vaccination against measles for adults. To help us in this, expert on vaccination UNICEF Catherine Bulavinov and the Ministry of Health. Measles is a viral disease that is transmitted from an infected person by air, while sneezing, coughing or talking. This virus can live in the air and on the surface 2 hours after the patient left the room. Usually vaccinated against measles, and therefore immune from this disease, kit in childhood, vaccination doing in 12 months and 6 years. But in Ukraine, the level of vaccination is very low. Very many adults unprotected from the barker because they once were vaccinated with only 1 dose, and may not have received immunity or the vaccine is improperly stored. At the moment, the measles vaccine is part of a combined 3-component of MO vaccine. It protects against 3 diseases: measles, rubella and mumps. But the cold, red throat and runny nose is not a contraindication to vaccination. Measles vaccine can be administered in 1 day with other vaccines such as diphtheria and tetanus in different parts of the body. This is a common shot. An adult is advised to do in the shoulder of the left hand if you're right-handed. The injection site may be a local reaction, pain, redness or swelling, which usually disappear quickly. The MO vaccine doesn't like direct sunlight and alcohol. Before doing the injection, you need to wait until the skin surface to completely evaporate the alcohol or other disinfectants, as they may inactivate the attenuated viruses in the vaccine. The probability of a serious allergic reaction to the MO vaccine is 1 per million vaccinations. Then, as from the thousands of people who get measles, 1 man dies, 1 sick with encephalitis, and 50 get severe complications, said the Ministry of Health. One of the main reasons for the spread of measles on the planet, the World Health Organization called negligence and the dissemination of false information about vaccines. In the 90 eyes of the surprise caused a discredited British study by Andrew Wakefield, where he claimed that there is a connection between the vaccine for measles, mumps and rubella, MO, and autism and bowel disease in children. Mr. Wakefield claimed that his insights are based on experience only 12 children, but no other study failed to repeat his findings. Subsequently, it was removed from the medical register in the UK. However, the rumors about the negative effects of immunization continued to spread, which led to a significant drop in levels of vaccination around the world. If a person is pricked correctly and with quality vaccine, she will not get measles. But there are people who, despite a vaccination, can produce immunity. The percentage of such people is very small. To predict or prevent complications from measles is impossible. Most often it is pneumonia and encephalitis, inflammation of the brain. This is a severe condition, which are treated in intensive care. In the beginning of the disease, people think they have the flu. You have a fever, cough, pain in the eyes. For 5-7 days, a rash erupts, then there could be vomiting and diarrhea. The temperature of the entire period of the rash is usually up to 40. When the rash goes, sometime remain dark spots. Need to get 2 doses of vaccine with a minimum interval of 28 days. The doctors say that it will form immunity against measles for many years, probably for life. According to experts of the ministry in the direction of an infectious disease Fyodor Lapy, the measles vaccination for adults in Ukraine is free. Now in public clinics of measles vaccine is, for both adults and children, said Mr. If vaccinations in the office say that there is no vaccine, the health ministry advised to complain to the head of the medical institution. If this does not help, then the Department of Health in your area. For the distribution of vaccines within the region meets the local authority. In such cases also make the vaccine. This corresponds to the WHO recommendations. Thus, the immune system begins to run a race with the virus, producing antibodies, explain in the Ministry of Health. If the man had contact with sick with measles, it is best to get vaccinated within the first 72 hours. Later is also possible, but the effectiveness of vaccinations would not be as high.